All set. Take it away.
Hi, my name is Amanda Olson. I am an occupational therapist with Health Promotion Partners, and I am a driver rehab specialist as well. So we do driving evaluations on a variety of people, all the way from new drivers that have some disabilities, all the way up to, I think my oldest at this point was maybe 94 years old. um, but we certainly see a fair amount of Parkinson's clients. And every time I've ever met with a lot of Parkinson's groups, people tend to have questions about what we can do for you, what our services provide, what we look at when we work with you, that sort of thing. So I don't know if any of you are currently working with OTs or PTs that have ever brought up driving. We do work with other OTs in the community that will refer to us as well. So we get people from physicians directly, from therapists, and just from clients that call us up and say, I'm not sure if my driving is still where it should be. Can you check us out? Um, so I'm open to doing this as casual as you would all like. So if you just have questions, I'm happy to answer any questions that you may have. Otherwise, I would say a big question I get often is, well, when should I come see you? Or do I have to come see you? um, you never have to come see me unless your physician is adamant that you come see me. Then I would suggest you come. Otherwise, in terms of when to be evaluated, we always say as soon as you're diagnosed is best. And it doesn't even necessarily have to be coming directly to me. It could just be seeing your OT in the community and having them do some driving screens, because they can do stuff in clinic to see if they even have current concerns about you driving. And if they do, then they may refer you over to us. So we have offices in the Springs, Westminster, and Fort Collins. I'm the OT in Westminster. Um, and if they refer to us, then we are the only ones that will actually put you in the car and drive with you. So obviously, we see a lot more, because I will be honest, there are times that I do tons of in clinic assessments and it seems like someone is not going to perform well on the road. So that's what your physician would see, that's what the clinic OT would see. And then you actually do fine on the road. Or we have things like restrictions that can get put in place. So I think a lot of people just have this thought that I can either drive or I can't drive. And that's not true. You can drive with no restrictions. You can not drive at all, or you can drive with restrictions. And what that might look like is no night driving, no highway driving, only driving on roads that are 45 miles per hour or less, only driving to familiar locations within a certain radius of your home. So those are all things that can keep you safely driving, but just maybe not at the capacity you were, you know, 10, 15 years prior. It's not this, when you come to us, it's not complete black and white of yes or no. There's always a gray area. So Parkinson's, I mean, there obviously, you guys all probably have some different symptoms, but there can be rigidity, difficulty with coordination, all that can impact parking, lane changes. Can you turn and do over the shoulder glances well anymore? That sort of stuff. And we have modifications to help you with all of those things to make it easier and safer and help you stay on the road as long as possible. So, um, obviously, there can also be cognitive changes, and those can be a lot harder for the client themselves to recognize. A lot of times that comes from family members or the physician. Your reaction time may slow down, your processing speed may slow down, and that can all greatly impact your driving. So, those are all the things that we're really looking at. So, coming to us right away, we get this baseline. and we know what you look like. And then if you progress and your doctor recommends you come back, we know what you looked like a year ago, 4 years ago, 10 years ago, whenever it may be. And it's much easier for us to see what changes may be taking place. Most of our progressive diagnosis clients, we recommend get assessed yearly, but it's always at the discretion of the physician and your family. If you all feel you look exactly the same as you did a year ago, then no need to come back. But it's up to them and you guys in the long run. I'd say, I guess another question I get a lot is, are there state requirements or laws around all of this? Colorado is a self-report state. So what that means is that physicians do not have to report anyone to the DMV. They are allowed to and can't be, as long as they're doing it in good faith, they can't be sued or anyone can't go against them, but they are not required. Whereas there are other states that if you are diagnosed with a seizure disorder or Parkinson's or dementia or MS, the physicians are actually required to report them to the DMV. That is not how it works in Colorado. The DMV expects you to report yourself, but nobody tells you that. So, and the questions that they ask on the form, in my mind, are stated very poorly. So it wouldn't even really indicate to you that they were looking for you to tell them that. But basically what happens is if your physician fills out this form called a DR 2401 form, that is their acknowledgement that you have Parkinson's, but you were found fit to continue driving. So the only time that would ever really come up, because we get asked about liability quite frequently, is if you were in a pretty significant accident and whoever you got in the accident with decides they want to try to sue you, they pull your medical records, they're going to try to use your Parkinson's against you, whether the accident was your fault or not. If the accident's your fault, it's your fault. Accidents happen. But if you have this form on file with the DMV, that pretty much gets taken off the table because they're showing, yes, we are very much aware that he or she has Parkinson's, but they were found safe to continue driving. So if this accident is their fault, it's not because they have Parkinson's, it's just because an accident happened. So it just gives you this extra level of coverage. I look at it like an extra insurance policy. So sometimes that's how people wind up coming to see me, is that they want this form done. The physician is hesitant to fill the form out. They say, go see Health Promotion Partners. Let's make sure everything really does look good. And then I'll fill out that form for you. And that's the same form that if we decided it was safest for you to drive with some restrictions, they would put those restrictions on that same form. So that's kind of the basics. Our evaluation is 3 hours. So we have you come to the office. We do an hour and a half in clinic doing assessments of your visual skills, cognitive skills, physical motor skills, and then we put you in the car for at least an hour of driving. And then we go back to the office and chat about everything. If you work with an OT in the community that we work with and you do the clinical screen with them, which would be the vision, cognitive, and physical motor, they send us your report. And then it's only a 2-hour appointment and we just chat a bit, like 20, 30 minutes, and then we just get in the car. So those are the 2 evaluations that we offer. And I have various equipment in my car, and then I also have a gas and a brake on my side of the vehicle. So if necessary, the hope is to not use it, but it's there if I need it. So does anyone have any questions? Has anyone gone through this process? Do they know? Did you know about this prior? I see. How much does it cost? Okay. Yeah. That's always a question as well. So yes, it is not covered by insurance because insurance thinks that driving is a luxury and not a necessity. So we unfortunately are private pay with the exception of workman's comp, people involved with the Department of Vocational Rehab, and we actually just started a contract with the VA. So if any of you are veterans, we can now see you, and that will be covered because the VA has an extremely long wait list at the moment. So if you have to pay private pay, our full evaluation is $480. Our 2-hour evaluation is $340. People have asked for a super bill and submitted it to their insurance. I don't honestly have any feedback about if insurance has ever helped, with the exception that I know Medicare does not. So it's usually a supplemental insurance that they try to send the super bill to. Somebody just asked, do I work in Florida? So there are driver rehab specialists in Florida for sure. One of the kind of OT driver rehab gurus actually was in Florida for a long time and recently retired. But if you are looking for someone out of Colorado, because I can tell you everyone in Colorado, there is a website called ADED. It's ADED.org. If you go on that website, you can search driver rehab specialists throughout the US. So if you ever need to find one in another state, that is a good resource for you. Any other questions?
Yeah, I see. Do you, if you want to say something, Irving? We can't hear you just yet, though. You're gonna have to try and unmute that screen.
Do we meet up closer to the client? Sometimes, yes. So I've had a couple clients come see me from Summit County, and then I've had a couple in Summit County that just can't get down here. So my boss just asks for a travel fee, and then I go to their house. So the other thing that sometimes happens is I see a client from our office. Things go okay, but not great. The next option is to do some training, because there is, like I was talking about, the modifications that we can make to make it safer. Sometimes you need a training session to learn different techniques, to learn the equipment. And oftentimes it will offer that training from your home, especially if you're telling me, like, I don't want to drive anywhere except 5 to 10 miles from my house. I have no desire to go on the highway. I'm not going to ask you to do those things. So yes, there are times that we will go and start at the client's house if it's necessary. Did you say it's to our advantage to report our Parkinson's to the DMV? So it's to your advantage if you report it with that form filled out by your physician. If you just report it to the DMV, they will ask you for that form from your physician. So if you want it done, the easiest way is to just ask your physician to fill out that form and then send it in. Because if you just tell them on your own merit, that's what's going to happen, is the DMV is going to say, thank you for telling me, we need a 2401 from your physician. And then you're just going to have to go get one anyways. And you can, I can send a link to Meredith or whomever, but you can also just Google Colorado DR 2401 form, and you can print out that form on your own. And neurologists that I work with are very familiar with that form. So they typically either already have it at their office or they know how to access it pretty easily. There's a different form that comes from your optometrist. That's a 2402 form, but unless your main issue is vision, it should just come from your medical provider. That being said, I don't know how long most of you have been diagnosed for and what your current symptoms are, but one of the biggest things that is seen with Parkinson's, one of the things that has been seen to go first, is something called contrast sensitivity, which is night driving, driving when it starts raining, darker, cloudier days tend to be more challenging for some Parkinson's clients. Let's see if there's any other questions.
I have a question regarding handicap parking. You know, the tag that you attach to the rear view mirror.
I didn't quite catch that.
My question is, how do you get handicap parking?
How do you get handicap parking? Your physician can provide you with a decal for that. So that's who you'd want to ask about that.
There's another question. Is there any reason not to report to the DMV?
In my mind, no. But I know that I've had clients more so, I feel like it's happened more with some of my either stroke clients or brain injuries such, but some physicians give pushback and don't want to fill the form out. They either don't know about us and don't know that you can come see us if they're nervous about clearing you just by seeing you in the office. But the reality is it can be any physician of yours. So say you approach your PCP and your PCP says, I don't want to fill that out. You can go to your neurologist, say, will you fill this out? Just needs to be a physician involved in your care. It doesn't need to be a specific physician. So I always encourage people, if one of them tells you no and you really want it done, go ask another. And then if you're still getting pushback, explain, everything that I'm talking about, that if they're nervous for whatever reason, you are happy to go complete this screen and show them that you're safe or whatever it may be. But I encourage all of my clients to have that form, because to us, it is this extra liability for you all and protection out there. When I see clients, I always send that form to the physician with the report after I work with you. So they always have it. We always ask them to send it back to us and send it to the DMV, but that rarely happens. So we unfortunately don't always know when the physicians have filled out that form. Let's see, there's another question. Would you suggest being evaluated by you before talking to the doctor? You can. I mean, it certainly wouldn't hurt, right? Because then you're going in and saying, I've already had this evaluation done. Everything went great. Would you fill this form out for me? You can show them the report. We do prefer to have a physician referral when we work with you. So we typically reach out and ask for that. And then, like I said, sometimes we're just getting the referral from the physician. So we already have one, but we do not need it. So we have had other clients that have called and said, I want to do this, but actually don't want my doctor involved. So can we just do it? And we can do that. But whenever people are willing, we reach out and ask for a referral from the physician. And then the physician knows that you're doing it. Looks like Al has a question.
Yeah. Got it. You got to unmute yourself real quick. See, I don't know if that helps. There is maybe like 3 dots in your screen in the top right that you could push. And that might help that might unmute you.
Or maybe it's at the bottom of their screen with a little microphone.
Or that bottom where that microphone is.
Can't hear.
Hmm.
Al, do you see that microphone on the bottom left? There you go.
Thank you.
Part does the insurance company play in the,
Nothing.
I heard something about the insurance company. Can you say it again?
what part does the insurance company play?
So your car insurance does nothing. The only thing, we don't reach out to car insurance. The only time we tell people to notify car insurance is if they're driving with equipment. So some people need hand controls or other devices. We always tell you to tell your car insurance because that is just probably increasing the value of your car, but for no other reason than that. It doesn't change anything. It shouldn't change the cost. I don't know if any of you have done, like, AARP has some safe driving courses, and you do typically get a discount on your insurance if you complete that course with AARP. But for us, yeah, they're not linked with us in any way. And then as for medical insurance, like I said, they don't typically help with any of this.
Hi, I'm Meredith. Can you hear me?
Yes.
What's the advantage of letting the DMV know?
So the advantage for you of letting the DMV know is if it comes with that form that I was talking about, the 2401, because then you have that on file and it's sitting there showing that, like, they are very well aware that you have a neurological diagnosis, but that you're safe to continue driving. So yes, it's hard for the fact that if nothing's happening and you feel great driving and you didn't get in any accidents and you're not getting in any accidents and you don't want to go through the hassle of getting that form done. Yeah, it's not like it just goes and sits in your file on the DMV.
So what is you mentioned the vision form? I think you said 2402.
Yes.
What is that?
It's the same exact thing. It's just that can only be filled out by an optometrist or an ophthalmologist, whereas the 2401 has to be filled out by a medical physician.
Is that just to show that your vision is good enough to drive?
Yeah.
Form?
So you really don't, with Parkinson's, it would be more the 2401, but I see clients that have low vision, so they don't meet the vision requirements of the state of Colorado. So the optometrist uses the 2402 to override the requirements of Colorado and say, yes, they don't meet the vision requirements in Colorado, but they drove with Amanda or they drove with Terry and they were found safe to drive regardless. And then it overrides that. So when they show up at the DMV won't do a vision screen because they know that they wouldn't pass it.
But you'd have to do the test drive with you in order to get that form?
Yes or no. It really just depends on the physician.
Okay.
So while I have people that do need special training with vision, and I have a bunch of optometrists throughout the state that just work with us regularly, they tend to send their clients. But if they just screen them in clinic and feel, yeah, you don't meet the state requirements, but I think you're fine, they can just fill out that form regardless of sending them to us. They don't have to send them to us.
Oh, okay. Okay.
So my question may be a little, sorry.
Go ahead.
My question may be a little repetitive, but just kind of wanted to go down the steps here. So are you saying that the first step is probably to talk to your doctor about getting the form so that we could come and get evaluated for a baseline,
Yes.
then get evaluated and then report to DMV?
Well, the form, so if you discuss all this with your physician and they just say, sure, I'll fill that out for you and we'll monitor you. And if I have concerns in the next year, 3 years, whatever it may be, we'll send you to do a behind the wheel screen. Then you really don't have to do anything else at that point, because when he or she sends that form in, it's going to the DMV. So it's notifying the DMV.
Okay. So you don't
If
have to do
meet
that
with your
personally.
physician and you bring all this up and you ask for that form and they're like, no, I don't want to fill that out. Then you can say, well, can I go, if I go do a driving screen, will you fill that out for me? And they may say, sure. So, I don't know where most of you are located, but the outpatient therapy department at UC Health does a drive screen, and I work with the OTs there. So if you're involved there, you can ask your physician to send a referral to do a drive screen at UCH main campus. The Colorado Springs campus, I believe, also does one, and then Longmont. So you could ask for that, and then you would only come to us for the behind the wheel. Boulder Community Hospital Outpatient Rehab also does a drive screen. I work with those therapists. I work with therapists involved in Innovage and Vibra. And then if anyone's involved in the PACE program, I don't know if any of you are familiar with that, but they have started connecting with us. And I actually think that they are starting to pay for some of the evaluations too. So you could always start with just an in-clinic OT screen at an outpatient therapy clinic first. I used to do that actually before I did behind the wheel evals and training as well. And then I would leave it up to the physician whether the client had to go do a on-road or if they were just happy with our screening and left it at that.
Does the form need to be renewed?
Typically not. It needs to be filled out with by someone that you've seen in the last 6 months, because they do have to put an exam date on there, and it needs to be a date that they've actually presently seen you in those 6 months. It can also be a physician assistant. I didn't mention that, but it can be an MD or the physician assistant. It just can't be a nurse practitioner. So they would have to ask the doctor to fill it out. It needs to be renewed in other situations, but for you guys, it won't have to be renewed.
One person asking if you would share your contact info.
Yes. So my direct email, if you have any questions that you want to ask me, is just amanda@healthpromotionpartners.com. And then that is our website, is healthpromotionpartners.com. And all of the office's information is on that website. My particular office is on 84th in Westminster. It's around 84th and Federal. The Springs, I can't even tell you the exact address. I've been down there, but I don't go down there enough to know. But it's on the website. And then Fort Collins is on like the western side of Fort Collins, is that office. So
I'm sorry, my phone kind of blanked out. I didn't hear the first part of that
here, I'll type it in the chat.
website. Okay, perfect. Thank you.
Amanda at Health Promotions Partners. I didn't hear that.
I don't know if any of you attend some of the Parkinson's conferences that are held, but there's a empowerment bar that was held last year, and it's being held again in September at the Hyatt Regency in the Tech Center in Denver. And we will have a booth there. So if anyone's going to that in September, I will be at that. Can find the date if anyone's interested, but that's
I think it's
That's
like
a nice event.
September 7th or something like that.
September
Yeah.
12th.
Did you say September 7th?
I think
I,
so.
I think that is. I could go
Kind of
get
sounds
the paper.
familiar.
How do I,
It's on the 10th.
10th,
Yeah.
okay.
September 10th, yep, from 9 to 2 or
Oh,
10 to 2 or something.
I should have taken that out when you sat down.
Oh,
What?
we're on the roll here.
how do I find out about that conference?
Take it.
Is there a website?
I'm sure there is. Let me pop
Mm.
into my email and grab it.
It's Parkinson Association of Colorado. If you go on their
The
website,
Rockies.
Rockies, I mean, yeah.
Rocky.
Okay,
.org.
.org.
Mm,
Is it called like e-conference, I think?
Right.
Yes,
The
E3.
The E3.
E3, that's right.
What?
I wouldn't have taken it anyway. No.
The calls. kept
I
going.
attended last year. Were you the presenter?
I was.
How do you have
Okay.
to stop it somehow? Just gonna wait till it's done.
Yep. So this year I won't be speaking, but we'll still have a booth there
Mhm.
with all of our information and everything.
But you would have to go through the noise and have it on there. Because we're not muted now.
Yeah.
Anybody else got any questions? Anything coming up that you could think about?
See a little bit. I'm gonna go trade the guitar for the amp.
About you, Amanda, got anything else you'd like to ask or share or?
I don't think so. I think overall is just being really open-minded about it. I think a lot of people get nervous and think we just want to take away your license, your doctor just wants to take away your license, and that is the farthest thing from the truth. Our goal is to keep you driving safely for as long as you possibly can. We know how important driving is for a lot of people, especially in Colorado. It's not like we have this amazing transit system that other big cities have. So while you have other options, it is trickier than other places. So that's our ultimate goal. And, you know, like I said before, my Parkinson's patients typically do fairly well. It's usually the big one with Parkinson's is freezing, right? So if any of you have that freezing component and it happens frequently and with your legs, like that is probably one of the ones that is the biggest challenge. So we've had clients that, you know, pressing on the gas, the goal is to go to the brake, they freeze,
You're nuts.
can't get off the gas, they can't get over to the brake, and something bad happens. But other than that, you know, the medications and exercise and all this other stuff that your physicians go over with you seem to be doing a great job with Parkinson's. So
Ooh. Anybody else got anything to add?
What's this? What's the status of the boxing programs?
We still going. We got in-person classes and virtual classes too.
We don't have, do you have a copy of them? Okay.
Yeah, they're on the website too if you guys need parkinsonspoint.org.
Most of them are earlier in the morning though.
That is correct.
They're usually at 9.
Yeah.
Doesn't work.
Good. Were you gonna say something too, Margareta?
I was going to say 8:30, the class.
Perfect.
Yeah.
Cool. Anybody else got any questions about this or anything that is related? Got there. I don't know what that is. That looks like just some button pushing. Cool. All right. Well, I guess if that's about it, and you know, we could end this, or if there's more, feel free to add. But sounds like that's about it. She did leave her information. Does anybody need that information that you didn't see it yet? You put in the chat. We got health promotions and her email. We also will put this stuff on the website or get it out. So if anybody else needs the information passed today or you lose it or whatever, we'll definitely be able to help you guys with that off of our website.
I'll also type in the website I mentioned for the person that was asking out of state.
ADED.
Mhm.
There's also just other,
AD.
oh, sorry, it's not .org, it's adead.net.
ADED.net.
So that will give you access to any driver rehab specialist throughout the world. I'm pretty sure that Canada and
You don't need that.
Australia and stuff are on there too. So you can get access to that. There also is they have good information and fact sheets on that website. So there's one specific for Parkinson's that you can read on, and then they can just direct you in other things. So
Okay. Sweet. Thank you, Amanda.